So with all of this being nimble and experimenting and sort of let's just try it, one of the things I've always loved about this particular group is that it's very tactical. It's very much a how to, this is how you do something. So I would love to know from each of you, what has worked? Something you just threw against the wall to see if it would stick. What have you seen very good results from, even though it may have been unplanned? And Brandy, we'll start back with you for that.
Well, like I mentioned, the videos that we are doing every day, and it's been well received. The videos are hosted by our Chief Experience Officer, and we're meeting with folks within the AMA who are experts, subject matter experts in the field, or talking to other experts, and that's been tremendous. The other piece that has been something that I don't think we really thought about it in the past is that we've been producing what we're calling guides. And so if you print it out, it would probably be, 1 to 5 page or 1 pager guides. And throughout the organization, based on like our strategic areas and focuses, which are really trying to like reduce administrative burdens and to help medical students and residents, we've been able to take some of that existing content, package it up into these really concise guides that we've been able to get out there on the website for our frontline workers. And it's been extremely successful where, media has been picking it up. There's been folks saying, this was like a lifeline for us. We've been able to really condense down information and listen to our audience, because our physicians actually reached out to us. And our kind of slogan is that we're the powerful ally, physicians' powerful ally in patient care. And so we've been able to deliver on that. And we've seen a lot of great success by looking at our analytics. We've had engagement to this content that I think has surpassed what we've done in like 1 year. We've had like that much engagement just in these few months. And people are sharing the materials. And I think, we probably would have never really thought about producing these type of guides in this way, except for this, situation has caused for that. And I'm just really proud, like across all of our different departments, everybody, all our subject matter experts, our marketing teams, we've all just kind of focused in on COVID-19 to deliver what we feel our audience needs. And it's been very successful so far.
Definitely. I think when I looked at the content that the AMA is pushing out, it's extremely timely. When you said I have pretty much meetings every 10 minutes or whatever it is, I can see how that's necessary for your content to be so timely, especially the daily videos. You actually have a Twitter chat right after this about how to safely reopen. I think that's amazing. Those are the kind of things that I think people, you're right. This forces that type of creativity.
Yeah, it's been really amazing.
Absolutely. Lisa, you mentioned things have gone viral. You guys are all over the news about increasing your testing and constantly communicating to, it seems like physicians, people who are interested in the innovations, and then also the residents just in your service area. What have you seen work? What has been your good success?
So it's been such an amazing learning opportunity, I think, for our greater department, because some things were serendipity, but I'll say that it all kind of started way back in January. One of my coworkers worked with our lead hospital epidemiologist, Emily Landon, to write an FAQ about the coronavirus. This was in, January 23rd. It was very basic, and that was back when everybody was calling it the Wuhan coronavirus, unfortunately. But we put together a fact very early on, ghost written, so it was written on behalf of Dr. Landon. And we found in February that it was starting to take off, even though the news in the States was not nearly as focused on the story. We were getting international traffic to our FAQ, and people were responding to some of the basic questions around what kind of treatments might work. People were guessing because people were comparing it to the flu. So they were asking questions like, does Tamiflu, work for coronavirus? If I had the pneumonia vaccine, will that protect me? So I did an extensive amount of looking at Google Search Console and understanding why people were coming to our site and what content was working, and then also looking at ways we could update the facts. So what we did is over time, we have updated this same file from January 23rd a few times. It's really transformed quite a bit. We've had video on there. We've taken video off as it's become no longer up to date. But you know, we made a point of keeping the questions on there that were originally driving traffic, but then just adding, taking ideas from questions that people were asking us on social, and just really curating this back. So since it went up in January, we've had more than 1.5 million views of it in 217 countries. Same Dr. Emily Landon, she spoke at the Illinois governor's press conference when he talked about the lockdown. So she really took off, and we were getting, you know, she was one of the top trending stories on the Washington Post site. So we're getting a lot of traffic around her. So we're just constantly pivoting, taking advantage of those things, but also showcasing how we're treating coronavirus and how our physicians are thinking differently about it. And some of that was serendipity too, because we had a research story way back in 2016 about these things called helmet ventilators, or like these big bubble ventilators. Well, apparently that's what they started using in Italy. And we had such good search credibility around this topic that we were getting lots of traffic to an old press release. So we updated it, we added new things. NBC National did a story on it. We incorporated that onto our site. So just constantly working, and then asking the doctors, like, how are we changing our care? What can we tell the public? Good news about coronavirus, if you can really say that, in the sense of, you know, helping people not just think doom and gloom, but, you know, we're working on preparing patient stories of folks who have been in the hospital and had, you know, some of them have been extubated, but, you know, we are trying to show that our doctors are using the science to shape the care right now, and it's good news.
So you both have said two things that I think are very good take-home messages for our attendees. Your existing content, like, even though this is a new virus and it's a very new pandemic, healthcare organizations at some point have written about infectious disease. Healthcare organizations at some point have guides, like you said, Brandy, or a press release that touched on this, and you can leverage that so you're not starting with blank pages and blank screens to create this content that you haven't really been able to plan for. That is such a good point.
And then real quick, Lisa, we had a question come in about what you maybe had to minimize or abandon to focus on the coronavirus. I didn't know if you saw that chat comment, the question.
No, I didn't see it yet. So minimize. So basically our whole team really had to pivot and focus on COVID related things. So we're not, you know, we had to tamp down advertising services that we were not available, you know, we couldn't do at the time in the hospital. I mean, that's changing. We're working on ramping up. But another important lesson about what we were doing is changing some of the language around the virus as we learn more about it and the ways to talk about it and being sensitive. So that was a big part of what we were doing. As I said, our original FAQ was talking about it as the Wuhan coronavirus. So of course we changed to be COVID. But in general, we really had to stop doing the, you know, like, obviously we're not doing breast augmentation right now. So we're not, you know, we're not working on that kind of content.
Yeah. And that's been across the hospital space, where some of the other services have just, you know, because you can't perform those procedures, you can't really talk about them right now. And honestly, I think the engagement that I'm seeing with our clients is that they don't really want to hear about that right now anyway. They really want to hear what you have to say about protecting themselves from this virus. So that makes perfect sense.
Yeah, but it's also a balance, because we have to keep the physicians, you know, engaged, and there's actually quite a bit of work that can be done virtually to prep. And then, you know, what we are working on too is there's still plenty of medically necessary you know, care that needs to occur. Like, your cancer is not waiting for coronavirus to be over So we need to be available for people and also convey that we are ramping up and how we're going to keep them safe.
Yep. Quick question from Amy for Brandy and Lisa. For this content that you're pushing out, what's the approval process? How many levels of approval does it have to go through for you to make these changes so quickly, both on the website and on social media?
Sure. For us, for the web, that's been another big change for us. Sometimes it would take, in our usual process, 1 week, 2 weeks to get through approvals and, Q&A. And we've been able to condense the process down into sometimes a matter of hours or a matter of 1 to 3 day turnarounds. And I think the reason for that is the organization has had to pivot. And so majority of our business units, our focus is on COVID-19, very much like Lisa, you said, we've put certain things, we prioritize COVID-19. So various items have been put on hold that are not focused on that. And so we're all concentrated on this. So the approval process, sometimes things do have to go to our board because AMA is a very matrix organization, but everyone is working very quickly and working very much together. So the approval process, sometimes it does require that is, the board, various senior leadership, the subject matter expert, those things are still happening, but they're just happening in an expedited way. And I think it's because we all know that this is what we're dedicated to working on right now. So it's been an interesting process to see how we've been able to take something that usually takes a long time, and when we're all kind of concentrated on it, we've been able to turn things around in rapid fire pace. And then I will say that there have been a few tiers of approvals that have disappeared, so we can turn some things around. So it just really depends on what the content is. But overall, the takeaway is that I think when you're focused, everyone is focused on the same objective. It's our passion and our goal to get things out very quickly.
Yes. Lisa, what about you? What's your approval process?
I would say the same in the sense that we're not really skipping levels. Maybe the one level we don't always have is sometimes we try to have, we'd have an editor on a piece. And of course, anything that has physician input or healthcare, topic is reviewed by a physician. We don't post things without that eyeball of a subject matter expert in the care area, if it relates to that. But we have a process where we will have an editor work with a writer, but we will also sometimes have like just a quick eye copy edit by someone else who isn't close to the content. We've sometimes had to cut that out because we don't have time. But one thing I will say that we've been trying to do for some of the FAQs topics is we've really tried to front load some keyword research that probably wasn't really happening as much as it should have in the past. We've actually gone back and redone some of our pieces because we felt like it didn't really hit the points because the writer was just moving so fast. Okay. And the web team had the better skills in keyword research to update and inform and change some of the questions.
Awesome. That's a really good way to keep it efficient. Let's go back and revise and update what we've already put out there. Stephanie, I begged Jen to beg you to be on this panel because I am one of those people that firmly believes that UX and content strategy should be best friends. Even in a world where we have to very quickly push out content, deploy different types of applications, there has to be somebody thinking about the user. That is my soapbox. So I would love to know, what have you seen be successful as you try to rein in clients and projects that are going out very quickly in a usually regulated environment? What successes have you seen with your clients so far?
Yeah, thanks for that question. I share that idea with you, Kadisha. I mentioned I'm the director of UX, but we have 3 pillars when we talk about UX at my organization. One is sort of UX design, one is content strategy, and one is research. And to me, those things are sort of very tightly tied together in terms of how we make decisions and how we help our clients to solve the problem that we're trying to solve. So I do believe that the sort of human center is important to everything we do. And what that allows us to do, my organization is a little bit different than some of the other panelists in that we're a digital consultancy, right? So we have clients who aren't specifically trying to solve for a COVID-19 crisis. We have clients who are focused on congestive heart failure, or we have clients that are focused on, other therapeutic areas. And so for us, some of what we're learning in the larger world based on these fast pivots related to COVID-19 are able to sort of raise their heads or benefit some of the work that we're doing in other areas. So an example is there's been a real push toward developing sort of outcomes-driven content. So what I mean is if you think about the digital space, a lot of times web applications or websites or whatever are all about what we want the user to do. Mm-hmm. And when you pivot that and you turn it into what are the outcomes we're trying to see or trying to measure or trying to solve for, it requires a team to work together to say, okay, we're driving toward an outcome. Let's work backwards from there to figure out how we're going to present that user with a journey to walk through to get them to that desired outcome, whether that be fewer exacerbations as a COPD patient, whether that means fewer hospitalizations for a diabetes patient, whether that means more visibility to a healthcare provider. What are those desired outcomes? And content strategy plays a critical role in that. It's not just about driving education and jamming it down the user's throat, right? It's about providing content in a format that allows users to digest what that is and come to an outcome.
Yes, absolutely. And that can be, when things are moving so fast, it can be very easy to lose sight of what is the result that we're going for. It can be very easy to lose sight of that. Thank you for sharing that and putting that reminder out there. We actually have on our content templates, what is the result this client wants? So before people start creating anything, keep that in mind. Yeah. Kimberly, successes for your organization, and let me just give a little soapbox about you too, because your organization is touching those people who are often forgotten, I think, in crises like this. We're very focused on the patients who are testing positive. I hear a lot about patients with diabetes and how they're coping. I hear a lot about patients with heart conditions, but people who are struggling with Alzheimer's or dementia or in an assisted living facility, which my understanding is that's your audience, are not getting the type of attention from mainstream news. So it's really up to your organization to talk to them. Is that right?
Right. And we have so many different audiences. We have caregivers in home settings. We have them professional caregivers in long-term settings. And so we've had to create various tips for everyone who might be dealing with someone who has Alzheimer's or another dementia. And so I think that I know you were talking about repurposing existing content, but we've been creating a lot of new content. And we've thankfully been seeing a lot of traction with our new tips. We quickly shifted focus to COVID-19, and we were creating a hub of all things COVID-19 because we were just gathering so much content across the site. We wanted to centralize it so various people could get what they need and keep moving forward. So we just launched this hub on Friday, and our CMO is most excited about the SEO results. And we've had some surprising success with our earlier tips pages, like page 1 results for the broad COVID-19 tips, and we're at the top of page 2 for coronavirus tips. So that makes us happy because that means we're reaching people and we're getting this information out there because we know people are looking for it. But we also have been translating the tips to reach a key Spanish speaking audience, and we're also seeing some traction there because there's far less Spanish content competing for ranking. And we're seeing a lot of new organic entrants to the site, so we're definitely broadening our reach with other programs and initiatives we have going on. And we know that we'll be iterating on our hub and our COVID content as information changes, but it's good to know that the things that we had to move quickly on and produce, they seem to be going in the right direction.
That's awesome. I've definitely seen your tips for if your family member lives in an assisted living facility. Tips. I think that shows that you guys have a good pulse on what they need, because it's probably more, tell me what to do. Tell me what to do. And that's like the need you guys are definitely filling.